Hola, ¿qué tal amigos? Tengan todos ustedes buenas tardes, bienvenidos a su programa de Expresión Latina, como estamos cada semana en mi canal 22, somos su programa Expresión Latina. Y el día de hoy tenemos a un invitado, pero antes vamos a saludarnos. Bueno, ¿qué tal Mario? ¿Cómo estás el día de hoy?
Yeah, pretty good. As a matter of fact, I'm happy to have, we have a doctor from Creighton, CHI Health. He's a pathologist, very well known in our CHI Health. And today we're going to present the topic, which is colorectal cancer, and it's going to be in English. So,
let's introduce our special guest today, John Gross. Dr. John Gross, ¿qué tal? How are you doing today?
Thank you very much. Thank you for inviting me today, Dr. Sanchez and Juan Carlos. I'm happy to be here.
We're very excited to have you back. You were here in the old studio that we had. Now we're in new house, so welcome to the new house.
It's wonderful. Thank you very much for inviting me.
And John, you are the very first guest into this new studio. How about that?
I feel privileged. This is great. Thank you.
It's so good.
So we're going to talk about colorectal cancer in the United States. So the first question for you is, what is colorectal cancer? Can you explain?
Yeah. So colorectal cancer is actually the third most common type of cancer for people in general, and it's actually the second most common cause of cancer death. It's actually cancer that arises from the lining of your colon and your rectum. The colon is sometimes referred to as the large intestine.
Wow, very interesting, very important topic, John, because in the community we know how important it is. There is a lot of people who are wondering about this problem because it is something that affecting the Latino community as well in a big deal, isn't it?
See, absolutely. It does affect the Latino community. And there are some genetic components to colorectal cancer, and then there's also some factors that the individual can control themselves. And we'll get a little bit more into that with diet and exercise and factors such as that. But there is a large percentage of people with colorectal cancer are genetic.
Perfect. Right. So it is quite common, colorectal cancer. For example, I believe, I don't know if you guys know, or at least knowing about President Chavez from Venezuela.
Yeah.
There is a possibility that he probably most likely had colon cancer. Yeah. And it was advanced, and that's probably why he was sent to Cuba, where they think that they can fix and everything. Yeah. Although they have good medicine over there, but I believe it was too late. And little things that I know about it, Mr. Chavez has some abdominal pain and probably a little bit of rectal bleeding.
Yep.
So it is quite common, and it's very well known that this can be prevented. It's just a cancer that can be prevented and cured. But for some reason, lots of people still not following that. We're going to talk about this later.
Sure.
But it is quite common.
So, John, this is the second cause of the most common cancer in the United States.
The second most common cause of cancer death. And it's the third most common. I believe in men it's prostate cancer number 1, then lung cancer, and then colon cancer. And for women it would be breast cancer.
Colon cancer.
And colon cancer. Okay, so I guess it is the second most common, I guess.
Yeah, it is.
So, a good question then it would be how colorectal cancer starts.
Yeah, so great question. So colon cancer starts with first small little mutations that over time develop secondary mutations. That's a problem with the DNA. Either the DNA is not able to repair little changes, or the DNA actually changes to make it grow more. But these changes over time get larger and larger, and then eventually can become invasive and spread, and that's essentially what leads to cancer death, is the spread and metastases of these cells. And as a pathologist, I'm responsible to diagnose and review the biopsies that gastroenterology physicians and surgeons give to us.
Very interesting.
Yeah, very good. So those polyps are mostly, I believe, is adenomas, right? Can you talk about a little more about
exactly. It? Yeah, thank you, Dr. Sanchez. So there's two basic types of polyps when you go to the doctor. One of them is called hyperplastic polyp, and that is less serious than another type of polyp called adenoma. And then there's several different types of adenomas, tubular adenoma being the most common type. And those are slightly more serious. But over time, those are the changes that can then lead to cancer down the road. And that's why it's important to get screened and to go to the doctor, because this is a type of cancer that if you catch it early, it's curable with a very, very good cure rate. Extremely good.
So if they remove it in time,
Absolutely.
you can prevent cancer,
Absolutely.
basically. Very good. Obviously, this is very interesting, and I hope you are taking some notes. It's so important for this type of cancer to be screened and be treated. Well, obviously, we have more questions for you. We have to perhaps take a few seconds to discuss, or at least thank Plaza Latina for their sponsorship. They have allowed us to use this place actually to be able to have our own show. So thank you very much, Plaza Latina, which is located in 24th and O. 24th and O. With that, we'd like to continue with questions, and then well, let's go ahead. Any more questions?
There is a very good question here, John. Well, all of these are good questions, and we are very excited.
Yeah, we have collected a lot of these questions from people that are really interested about this, so that's what we're doing here.
Señor, señora, me encantaría hacer este programa también en español.
Y lo vamos a hacer.
Porque el doctor Gross nos está dando información muy, muy importante acerca de este tipo de cáncer. Quizás, Mario, empezamos a traducir un poquito lo que está diciendo el
Esta parte tal vez
Gross.
podríamos traducir. So we're going to try to maybe translate a little bit if we have time, but you know the time is limited. Although nobody's paying us for time.
El doctor Gross also
Anyway.
habla español, así que está aprendiendo.
Right.
Mejorando.
So
Mi esposa es...
habla español.
Yes,
Okay, very good.
Su esposa es colombiana, así que saludos para Stephanie también.
Yeah,
Okay?
very good.
Saludos para Stephanie. Y para Colombia.
So a question for you, another question from the community says, what are the risk factors for colorectal cancer we can control, that we can control?
Yes. So that's a great question.
That means we cannot control. Let me put it that way. We cannot
the ones
control.
you cannot control. So your age, you can't control your age, who your parents are, and your genetic history. And some of those genetic
You can
things,
no control over
you cannot control those. Other issues with that are, if you've had, let's say, more polyps than some, but the main ones are your age and your family history. Those are the main ones. Now the things.
Now, there are also, I guess, some factors that you are able to control indeed or not.
Yes, there are absolutely factors that you can control. The biggest is obesity.
You can do that.
Yep. Yeah.
And you can repeat that. You can say that again.
Yes.
Obesity is a risk factor
Yep,
for colon cancer. That's right.
And it's a risk factor for colon cancer, but it's also a risk factor for several other types of cancers. So besides just having general well-being with your heart and diabetes, it helps cancer or cells grow, and it's a risk factor for cancer. Secondly, exercise is a risk factor, or the lack thereof of exercise is a risk factor for cancer. And then not drinking enough water and eating a diet low in fiber. So fiber is actually protective for colon cancer. Having things kind of move quickly through your colon and rectum actually is helpful.
Esto es muy importante para decirlo en español, Mario.
Yeah.
Dice el doctor Gross que hay ciertos factores que uno sí puede controlar. Entre ellos, él nombra el caso de la obesidad. Es algo que tú puedes controlar. Él dice que también
Se asocia con el cáncer.
se asocia con el cáncer y con otro tipo de cáncer también. Y también nos dice el doctor Gross de que la falta de ejercicio es algo que también tú puedes controlar y que te puedes ayudar a ti mismo en contra del cáncer. Y también nos habla de la fibra, lo importante que es la fibra, el que consumamos fibra,
Vegetales.
y también el agua.
Sí.
Son factores, son cosas que uno puede hacer en favor de uno mismo con respecto a este tipo de cáncer. Importantísimo, ¿no?
Yeah.
Ahora,
Also, limit las cervezas.
Sí, las cervezas.
Las cervezas, you have el vino, the wine, cervezas, beer. You have to limit. I mean, it's okay. It's nice to have maybe a one or two, but don't overdo
from time
it.
to time.
That's right. That also is a risk factor for colon cancer.
Yes, it is. It's a small risk factor, but it's definitely a risk factor. And so is smoking.
Smoking,
again,
oh yes.
Both of those are risk factors for other
fumar,
types of
¿verdad?
fumar.
El fumar también es un riesgo.
Sí.
Okay, what are the warning signs of colorectal cancer?
So the warning signs of colorectal cancer, there's several. The largest or the most obvious is blood in the stool. Now you can have blood in the stool for many different reasons, but constant everyday blood in the stool should warrant you to go to your doctor. Most of the causes of that are hemorrhoids and other things that are not cancer, but sometimes that's a warning sign for that. Other things are fatigue, weight loss that's unexplained, any changes in your bowel habits, going to the bathroom irregularly, and some abdominal pain.
Constipation, diarrhea.
Yes, constipation, diarrhea. But I would say the biggest is weight loss and blood in the stool.
And abdominal pain. Yeah, abdominal pain too, yeah. Very good. Good questions, and I hope someone's taking notes about this. So remember, obesity, right?
Yep.
Cigarettes,
obesity,
beer, alcohol,
fiber.
the lack of exercise, all those things contribute to the, or at least it's associated with colon cancer. That's the word, it's associated with
And these are things that you can control.
That's right.
Un par de señales que dijo el doctor Gross ahora que hay que poner atención es si cuando va al baño, por ejemplo, en el excremento tiene sangre. Ese es una señal bastante clara. Otra es la pérdida de peso sin ningún tipo de explicación. ¿Y qué
dolor de abdomen o dolor de, ¿no?
Dolor de abdomen también.
Dolor.
Son señales que hay que estar atentos.
¿Dijiste sangre en las heces?
Sí.
Sangre en las heces, Eso son, y la edad, obviamente. Después de los 50 años, generalmente los problemas de cáncer de edad.
Perfecto, doctor.
Muy bien. Con eso, pues, nuevamente queremos que ustedes pongan atención a todas estas respuestas que le está dando nuestro amigo, el doctor John Gross. Y con eso nos vamos con las siguientes preguntas. ¿Comenzamos?
Ok, aquí tenemos una pregunta, Dr. Gross. Es, how do you screen for colorectal cancer?
Okay.
How do you do that?
That's a great question. So we recommend screening for colon cancer by colonoscopy or a sigmoidoscopy, which is a little bit smaller of a thing, of a test. At age 50, beginning at age 50, and then every 10 years after that to the end of age 75.
Empezando a los 50 años, se tendría que hacer la colonoscopía y luego 10 años después. 10 years after?
Yes, 10 years after the first one, as long as all of your colonoscopies have been negative.
That's right.
or keeps you in the general population as far as risk factors. Now, if you have a first-degree relative that has had cancer before, or if you've had a history of adenomas, which I referred to earlier as slightly more dangerous of a polyp, then the recommendation is to go every 2 to 3 years. Furthermore, what you should ask of your family physician, if they don't tell this to you already, is every year you should have a little bit of stool and put on a little card. It's called a fecal occult blood test, FOBT. And so that detects blood if there's in the stool, because sometimes it's mixed in and you can't really tell. Also, the doctor will do on your annual examination what is called a digital rectal exam, where they will place their finger in your rectum, but that's just checking for any palpable masses. But a lot of these cancers cannot be palpated, so that's why you need the colonoscopy. But colonoscopies are very preventative and are very effective if done properly.
Yeah, so among
Colonoscopy.
Colonoscopy.
among all those tests, to me, I think the most accurate is the colonoscopy. Why? Is because if you find a growth there, a polyp or something, you can actually go ahead and remove it.
Yes.
And send it to a pathologist like you, so they can study and let you know if this is malignant or not,
right,
or if it's advanced or not.
Right.
So I think colonoscopy, I usually, or I always, I order a colonoscopy for my patients at the age of 50 or above.
Yeah.
Even younger, at the age of 40, if they have family history of colon cancer.
Excellent. Yes.
¿Otra pregunta, doctor?
Yeah, please.
Okay. This is the good one. Dr. Gross, here we are. How do you diagnose colorectal cancer? ¿Cómo lo vas a diagnosticar?
Sí. So the initial diagnosis is done through a colonoscopy. There will be a little kind of pincher that will grab a little bit of the tissue if there's a suspicious area in the colon. And then that little tissue would put it turned into a little slide that I will examine under the microscope. We look for changes in the cells that are suggestive of cancer, and then there's very predictable those changes, and so that's how it's done. And then if the changes are bad enough, we'll say it's cancer, and then you'll be referred to an oncologist and or a surgeon for the next step.
Very good. So following some of these questions, there's quite a few questions that actually the community have sent to us. And then number 8 is, how do you prevent colorectal cancer? That's a good question, I think, for most people. How do we prevent, or how can we prevent colorectal cancer?
So again, it's there's a lot of things that you can do to prevent it, and even sometimes if you do all these things, you still may get it. But there's things that you can do to help.
Well, at least reduce the risk.
Yes,
right?
reduce the risk, and that's exactly the key. And that's one of the things, our main points for tonight, and that is exercise more, at least 30 minutes a day. 5 minutes. That's not easy to do. I understand that, and I don't often get 30 minutes a day. We're all busy, but exercise more, eat more fiber in your diet, and drink more water are the main things.
The next question, it had to do with the mortality rate of this cancer. It said this: colorectal cancer is expected to cause about 49,000, almost 50,000 deaths in the USA during 2016, during this year. It is expected almost 50,000 people are going to die. Why we cannot decrease the number of people that die from colorectal cancer in USA?
I think it's an excellent question. So in other words, why do we allow, maybe not allow, but why 50,000 Americans have to die every year when we have all the tools, all the tests to be able to prevent that disease and prevent death? Why?
That is a great question, and I think it's multifactorial. Part of it has to do with insurance costs. Sometimes the insurance may not cover a particular thing. However, they should. You should check with your insurance provider, because this is preventative medicine. And I would say, combined with that, is a lot of patients don't want to go through the colonoscopy themselves. They feel embarrassed to go to the doctor and have a probe. And they also don't like the preparation that you need to take. You need to drink a special solution, and you have loose stools for at least 8 hours or so. So, and that's kind of a barrier. But and furthermore, people say they're too busy and everything like that. My own mother, is afraid of going and having a colonoscopy, and so these are conversations that I would like to see more patients have with their physicians and feel comfortable to go to the doctor, because it will save lives.
So the way I approach this is, it depends on each doctor. If you really care for your patient, you have to put a little more time. And when you sit down with them and explain for one thing is the importance of that test. But they still say, you know what, that might hurt. I had to drink the stuff and clean it for 2 or 3 days. It's just horrible. Then I said, you know what, I had a colonoscopy. Okay. What I did is, yes, I know it's horrible to drink that stuff in one day. What I did is 3 days before my procedure, what I did is a soft diet, very soft diet, liquid diet. And 1 day before, just a few stuff and you clean the whole thing. Second, I tell my patients, you know what? It doesn't hurt. Why? Because they put you to sleep.
Yeah.
Right? And then when you wake up, I don't remember anything. No pain, nothing, zero.
Yeah.
So I explained what they do is they put a small diameter tube into the anal area with a little camera there, you know, and then less than 25 minutes or so, it's done. So a lot of these people actually, once they listen to you, they say, well, if you did it, I can do it. So that's the way you need to approach your patients and let them know. I think it's very effective.
When I entered 50, I also did it. It wasn't that terrible as people think, because as Dr. Sanchez said, you don't feel it. You don't feel anything.
You don't feel it. You don't even say, do you guys do it? Yeah, it's done.
So,
So we have a few more questions, right?
Yes.
Okay.
Let's keep going.
This is maybe the most important question that people need to know, Dr. Ross, and that is, how is cancer treated?
So sometimes you can actually have a curative colonoscopy. That actually does happen. But assuming that doesn't happen, you'll get referred to surgery. And surgery is the primary mode of treatment for colon cancer. But depending upon where the tumor is located or the size, which would determine the stage, sometimes it's treated with chemotherapy and radiation. For cancer that has spread to other organs, most commonly the liver, but it'll go, liver, lungs, can even certainly go into the lymph nodes. That's usually treated with chemotherapy and radiation only.
How effective is the treatment?
Very effective. If caught early, colon cancer is one of these miracles in medicine that with appropriate screening and the appropriate steps done by the patient, we shouldn't be seeing these 50,000 people dying per year of colon cancer. If it's caught early, it's remarkably effective, the treatment.
Very good.
Wonderful. Is there any advanced treatment, new research on this field about treatment?
Yeah. There is. There's new targeted chemotherapy, new drugs coming out seemingly every year, as well as more minimally invasive types of radiation. The surgery can be done minimally invasive, so you'll just walk out of there with a couple little pinches in your abdomen, and they will go on with the camera. So you won't have a huge gaping incision. Granted, every case is different, but the early types of cancer, most of the time that can be done laparoscopically.
And less invasive. That's good news.
So I know what we have learned today is, you know what, is much better or more important to prevent cancer. It's easy to prevent. Now we have the tools, endoscopy, we have pathologists that can study it, surgery, chemotherapy, radiation, all kind of stuff. I mean, if you get if you have a colon cancer or colorectal cancer, there's no reason why you should die.
Right.
Because you have all the tools to prevent, and not only prevent, but cure and treat it. And you can live a long life.
Yeah. And that's exactly right, Dr. Sanchez. You may do everything to prevent colon cancer with your own diet and your lifestyle, but you still may get it. However, this still doesn't mean that you're going to die from colon cancer. As long as you follow the doctor's guidelines, go and get your colonoscopy, and move on with your life.
Yep.
How much time do we have?
We got 1 minute.
Only 1 minute, Dr.
John
Gross. Thank you so much for being here. Give us a message to the Latino community today.
Edgar,
in Spanish.
Gracias para la invitación y yo estoy muy contento con Expresión Latina y gracias para la invitación, Juan Carlos y Dr. Sánchez.
Ya,
Muy
Muchas
bien,
gracias.
excelente.
Yo creo que tu español está muy bueno, está mejorando bastante. ¿Te acuerdas cuando te conocimos ahora? ¿No? So your Spanish is definitely getting better. It is so important to speak at least 2 or 3 languages. Remember, if you learn another language, your IQ goes up too. It's true. You know, it is true.
In research.
That's right. That's one research to increase your IQ, and then so great. Thank you very much again for being with us, and I hope this is not the last time, and I hope you can come back again whenever we need your knowledge and your experience.
Well, thank you very much for the invitation.
Thank you so much. Gracias por venir. Estamos muy
So
contentos.
we will have seconds in our time. So.
Señores y señoras, se nos acabó el tiempo, así que otra vez un tema muy interesante. Gracias al doctor Gross, doctor Sánchez, a Creighton por darnos estas grandes personalidades dentro de nuestro programa.
Hay que también saber que el doctor John Gross es de CHI Health y Creighton University. And thank you very much for that opportunity to have John Gross with us.
Si Dios quiere, entonces nos vemos la próxima semana. Gracias.